Coming to the next question, previous year NEET question discussion 2025. Another question in respiratory medicine, and it's a question on ABG. So, a patient presents with chronic progressive dyspnea. He is a known case of COPD. ABG shows pH of 7.32, PCO2 of 60 mmHg, bicarbonate is 34 millimeters of mercury. In NEET 2025, 3 questions had come on ABG. So, the normal pH is 7.35 to 7.45. pH less than 7.35 is called acidosis, and pH more than 7.45 is alkalosis. In this case, pH is 7.32, so this is an acidosis. Acidosis can occur due to 2 reasons. One, it is a respiratory acidosis or a metabolic acidosis. Any change with CO2, the prefix respiratory comes. Any change with bicarb, the prefix metabolic comes. So in respiratory acidosis, the carbon dioxide level has to increase. CO2 is basically an acid because it gets converted to carbonic acid. So when CO2 increases with acidosis, it's called respiratory acidosis. The normal PCO2 value is 35 to 45. So when the PCO2 increases more than 45 millimeters of mercury, we call it as respiratory acidosis. The normal bicarb is 22 to 26 milliequivalents per liter. When the bicarb is less than 22, we call it metabolic acidosis. So in this case, we have pH of 7.32, which is acidosis. So we have to see whether it is respiratory or metabolic. PCO2 is high, so it could be respiratory acidosis. Bicarb is not low, so it cannot be metabolic acidosis. So definitely this is a respiratory acidosis. Right? So ABG is low, so it's acidosis. PCO2 is high and it is respiratory acidosis. The question itself gives a clue. It's a chronic progressive case. The patient is having a chronic respiratory disease. So this obviously has to be a chronic respiratory acidosis. You need not break your head to put the calculation to know whether it is acute or chronic respiratory acidosis. The clinical clue itself says it is chronic respiratory acidosis. If at all you want to know the formula, in acute respiratory acidosis, there is something called as compensation. What is compensation is, when PCO2 increases by the same direction rule, the bicarbonate also has to increase to compensate for the rise in PCO2. In acute respiratory acidosis, for every 10 rise in PCO2, the bicarbonate should rise by only 1. There is no time for compensation. Whereas in chronic respiratory acidosis, for every 10 rise in PCO2, the bicarbonate should rise by 4. So our value is 60, which is around 20 millimeters above the normal range of PCO2. So when there is 20 rise in PCO2, in chronic respiratory acidosis, the expected bicarbonate should be above 8 of the expected value. That is 8 plus or minus 2. The normal average bicarb is 22 to 26. We will take 24 as the normal value. So 24 plus 8 will be 32 is the expected bicarbonate plus or minus 2. Our case it is 34. So the compensation formula also fits. So it is actually a compensated chronic respiratory acidosis. You need not, for this case, during the exam, you need not go to the compensation step at all, because we clearly know it's a chronic respiratory acidosis and it's a chronic case by the history. So you can straight away mark the answer of chronic respiratory acidosis.